Hello, let's discuss this question. A 34-year-old man comes to the office due to erectile dysfunction. For the past 2 months, he has had pain and penile curvature during erection. Okay, so for the past 2 months, he has pain and penile curvature during erection, which has made vaginal penetration difficult and has started to adversely affect his self esteem. The patient has no urethral discharge or other symptoms. He smokes a pack of cigarettes daily and does not use alcohol or illicit drugs. The patient has had a total of 5 female sexual partners. Vital signs are within normal limits. Cardiopulmonary examination shows no abnormality. The abdomen is soft and non tender with no masses. There is no inguinal lymphadenopathy. A palpable plaque is present on the dorsal side of the penis, approximately halfway between the glans and the pubis. The testes are normal with no scrotal erythema or skin ulceration. Which of the following is most likely diagnosis? So, in this 34-year-old male patient with erectile dysfunction, 34-year-old male with erectile dysfunction has a pain and penile curvature during erection, and on examination there is palpable plaque on the dorsal side of the penis. So the pain and curvature, okay, the pain and curvature plus the examination findings of plaque on the dorsal aspect of the penis, it shows us the Peyronie's disease. Okay, so this is Peyronie's disease, and the option C is correct. So let's discuss and look into the explanation of this question. So this patient's dorsal penile plaque and the pain and curvature with erection likely indicate Peyronie's disease, a common condition affecting 5% of the men that arises due to repetitive blunt trauma to the penis during sexual intercourse with subsequent aberrant wound healing. It is characterized by the formation of the fibrous plaques due to transforming growth factor 1 upregulation in the tunica albuginea, okay, which reduces tissue elasticity and expansion during erection. Manifestation generally include penile pain, curvature, and dorsal plaques or nodules or plaques. Distortion of the penis during erection may make sexual intercourse difficult or impossible, leading to body image and relationship issues. Most cases are diagnosed based on the clinical findings, but ultrasound is sometimes necessary. In many individuals, the pain and deformity resolve spontaneously over 1 to 2 years. The pain and deformity. Okay. However, those with active or progressive Peyronie's disease often require non-steroidal anti-inflammatory drugs for pain, pentoxifylline to reduce fibrosis, and intralesional injections of collagenase. Surgery may be indicated in refractory cases. Okay, so many individuals, the pain and deformities resolve during over 1 to 2 years. But however, with those refractory cases, the surgery may be indicated. While the other choices like genital warts, which is also called condyloma acuminata, typically present with clusters of small pink or skin colored papules. Okay, although plaques can occasionally occur, they are usually painless and do not result in erectile curvature. Then the second option of the penile cancer, okay, so it is also not right because the penile cutaneous squamous carcinoma in situ, which is also called Bowen's disease, may develop in the penile shaft but typically present as a painless erythematous plaque It may progress to penile cancer, which is the most common in older men aged more than 60 and usually present as a painless ulcer or nodule with inguinal adenopathy. While the choice D of the systemic sclerosis, it is also wrong because it can cause skin induration and fibrosis, but it primarily affects the hands, fingers, and face. Vascular manifestations such as Raynaud's phenomena and telangiectasias are often prominent. The choice of the primary syphilis is also not right because it is associated with painless genital ulcer. Tertiary syphilis may cause mucocutaneous plaques, which are called gummas, but the lesions are typically painless and often ulcerate. So, the Peyronie's disease is an acquired disorder characterized by fibrosis of the tunica albuginea of the penis, which restrict tissue expansion and flexibility during erection. Manifestations often include penile pain, curvature, or dorsal plaques or nodules, distortion of the normal erectile shape of the penis make sexual intercourse difficult. So this is about the Peyronie's disease.